this section, we will talk about how to perform supraliminal tests with Harp. While measurements obtained with pure tone and speech audiometry tests can give an indication of conduction, sensory or mixed problems, supraliminal tests allow the audiologist to identify the level of hearing damage in greater detail, and in particular, to distinguish between cochlear and retrocochlear disorders. This video describes the supraliminal tests that can be performed with the Harp audiometer, along with other tests such as Stenger and Master Hearing Aid, and 10 test, optionally available on the Plus version. The alternate binaural loudness balance test is used to determine the presence of recruitment. It is applied in cases of unilateral hearing loss or where there is an asymmetry of 25 to 60 decibels between the tone hearing level threshold of the two ears. SISI, Short Increment Sensitivity Index, is used to assess the ability of the ear to identify brief variations of intensity in a continuous pure tone. The patient should press the patient button each time an increment is perceived. DLI, Difference Lyman for intensity, is used to determine the amplitude of the smallest variation in intensity of a pure tone that can be perceived by a patient. Stenger test uses the Stenger effect to establish if a measured hearing threshold is genuine. Tone decay is a mono-aural test used to measure the loss of hearing associated with continuous acoustic stimulation. Master Hearing Aid can be used to assist the selection of a hearing aid for patients with impaired hearing. 10 test can be used to detect a dead region in the cochlea by measuring the detection threshold for a pure tone in a background noise called the threshold equalizing noise.